So I mentioned this a couple of times. This is the final day of school for the Columbia Public School District. So kids are going to be active in the summer. They're looking forward to playing. And I've seen more and more trampolines in backyards over the last few years. And so we're going to talk about safety on trampolines. We'll talk about that and then other things just to keep in mind as your kids are out playing, maybe some safety advice and some things that you'll want to keep thoughts about, and then how to react to certain things that happen. From the MU Healthcare, Dr. Sumit Gupta is here. He is a pediatric orthopedic and spinal deformity specialist, and it's good to see you, sir. How are you?
I'm good, thank you. Happy to be here.
Let's talk about trampolines. As a physician who looks at pediatrics, orthopedics, what do you think of when you think of the word trampoline?
Well, the data in our field is quite clear about trampolines and the health hazard that they pose. There have been several studies now that have shown a very large health burden by them. We see a lot of fractures with them. We see a lot of sports type of injuries with knees and hips and ankles. And occasionally some of the more severe injuries, such as neck or back injuries, that can even cause lifelong problems. So our professional society recommends that trampolines should not be used for recreational purposes.
Is it because the people who are using them fall off the trampolines, or just landing on the trampoline improperly can cause the problems?
There are many different ways that the trampolines can cause injuries. Those are certainly some of the ways. I would say that the most common way that we get injuries is when there are two children of different sizes on the trampoline. The bigger child jumps on it and the smaller child gets thrown off because of the excess amount of bounce. That's too much for their body weight. So typically that's one of the more common mechanisms because the height involved is much, much higher then. So
would you suggest then one at a time on a trampoline?
I think that's a very prudent safety tip. With one child at a time, the amount of injury that can happen is a lot lower than if there are two children, and especially if there's a big size difference.
When the experts look at this trend, to me it seems like there are more and more trampolines. I mean, I see it used to be like when I was much younger, I don't know of anybody that had a trampoline in his or her backyard. It was unheard of. There were trampoline, I don't know whether to call them parks or what, but I mean, the towns used to have trampoline jumping pits or something like that. And I guess if the trampolines were flush with the ground, it would be perhaps safer than the trampolines now that you think of in the backyards, which are raised and they're circular most of the time. Some of them do have nets around them.
And David, that's absolutely right. One of the other risk factors for trampolines is when they are sitting higher up from the ground. As you can imagine, if you fall off those, the extra height of that ground will cause extra injury. Unfortunately, a lot of the trampolines now that are larger size, they're just much easier to build if you can just lift them off the ground rather than having it at ground level and digging a hole.
Other than the fact of one at a time jumping, what other safety tips do you suggest?
Well, we generally recommend that if families are going to have a trampoline in their backyards, then a couple of other simple things they can do to ensure injuries include having adult supervision at all times when a child is on the trampoline, as well as making sure the trampolines are under good repair. So making sure that there are no tears, that the springs are all covered up by some kind of foam, and that all the netting that's there is in good repair.
Does the netting around a trampoline, to me, it looks pretty flimsy. I don't know if that actually helps or not. I guess it does, or else they probably wouldn't have it there.
I think the netting does give a false sense of security. As far as the literature and data goes on this, it hasn't really shown any difference in injuries with trampolines that have netting and that don't. So my personal feeling is it doesn't really change the injuries very much.
When you say knee and ankle injuries and things of that nature, what kind are you talking about?
So knees and ankles commonly get a lot of sprains in the more severe falls, and in the younger kids, they can even get fractures around the knee joint itself. This can cause a lot of problems. Sometimes they even need surgical fixation. One of the other things we worry about in children is if the injuries are on the growth plates, that can once again have a much more long-lasting impact.
We think that young people sometimes are invincible. They'll bounce back from things, and I don't mean to be really, I shouldn't have said bounce because we're talking about trampolines, but we think that they just don't really need to, that they recover well, or that they seem to have bones that are more malleable or something. Is that true or false?
Well, it's mostly true, and thankfully for me, with the injuries that I see, I know a lot of them will recover eventually. But that's not the only cost that we have. the cost of an injury is much higher than that. It's bringing the child to the appointments and all the medical costs, but there's also a large number of non-medical costs, such as time that needs to be taken off from work. If kids have a cast on, some daycares will not accept them, so then that means parents taking time off work. That really can be very disruptive to the families. The other thing is those are most of the injuries, but there's a small proportion of injuries that are much more severe, maybe needing surgery and maybe even leading to permanent disability.
Trampolines seem to invite risk-taking.
I would definitely agree with that
Sometimes people
statement.
are jumping off of things onto a trampoline and they don't realize what the physics of that angle is going to put them, where it's going to put them, and then it causes you to, as you said, maybe have somebody else jumping on there because it gives you that lift. Sometimes you're thinking, if somebody else could jump right at the time that I'm hitting as they go up, then this is going to be a thrill, or things of that nature, and then trying to do flips and all those other kinds of tricks.
Absolutely. I think the temptation is there, and children are young and impulsive, so they like doing that and like flying high. And I think that's why supervision is very important, and for adults to understand why these injuries happen.
What are some of the youngest patients that you have seen who have had a trampoline injury?
We see them as young as 2 or 3, basically. As soon as they start walking and being able to run and jump a little, they get on the trampoline. And most of these injuries, kids that little can't jump high enough to have a major injury, but that's where they get on with their siblings, with their older siblings, and get thrown off the trampoline.
Yeah. Any other kind of summer activity that is going to create a whole lot of work for you? Is it bicycle injuries? Is it other kinds of injuries? Are there anything else that you want to leave us with for the summer?
Well, I would just say, be very conscious about safety concerns. The really bad injuries we see are with motorized vehicles such as ATVs, lawnmowers. I mean, one of the most common, safety precautions to take with lawnmowers is to not have a child riding with you. And unfortunately, those injuries are extremely severe, usually leading to the loss of a limb. And there's not a whole lot we can do in the medical field about those. So things like that, I would just say be conscious about safety precautions.
Boy, it scares me to death when I see somebody mowing with a kid on his or her lap. I don't understand that. I don't understand why you want to try that.
It's very scary for us too.
All right. Well, good advice today. I appreciate your insights, especially into the trampoline world. People are going to have trampolines, but your advice is that if you have one, make sure that it's in good working condition, that you've got parental supervision or adult supervision, and one at a time. Those are the key ones, right?
Perfect. Yes, I would agree with that.
Thank you, Doctor. Appreciate it.
Thank you. Pleasure being here.
Dr. Sumit Gupta, who is from the MU Healthcare and orthopedic surgeon, has been our guest.